Live. Hello, everybody. My name is Benjamin Tale, and I'm here working for Esther Rodriguez, and this is Marcos from Mexico. And today's lesson of the day is you should drink tequila and have Chick-fil-A and more tequila. Yes. So, lesson of the day today, if anybody's wondering, was Wednesday. It's hump day, and we tell everybody hump day means that's the day I get humped. So it was a rough one today. My poor patients had to wait a long time today. They always look at me like, why, and I just feel so terrible. Lesson of the day today. Oh, hello in Pakistan. Lesson of the day today is about longevity of surgery, because this was something where I got a lot of questions about it today. Question I have for everybody, though, and you can answer as we go along, is what do I do with this painting? So I have this. It's been sitting in the office for a while. It was a gift, Esther, so we don't trash gifts. I don't say that. But I wonder what people will think if I have this hanging. So where shall I put this? Other thing, if you guys haven't seen yet, we have a wall of visitors here that's starting, and everyone who's visited is going to be up on this wall. So we have to fill the rest of the wall. We have tons and tons of photos. And that's that. So, somebody says trash can. Bathroom. Okay, there we go. Okay. All right, in the bathroom. Lots of bathroom options. Well, so just so people know what my bathroom looks like. It's a little fancy, guys. This is a mosaic. That's what the bathroom looks like. So, we'll see if we can go over there. So, perfect. So, now, the question I got today a lot, this is Alex painting, was how long was my surgery supposed to last? And this was from patients who had surgery by other surgeons. And this led into a lot of questions about why they looked so good initially and why things went away quickly and all these things. So, first off, when you do aging face surgery is like brow lifts and eyelids and things where you look older. That's called aging face surgery. Most of them are likely going to last about 10 years if it's done properly. So if you do like a really, really good surgery, they should all last about 10 years, and then you age out of it because you keep aging. And it's not that you stay perfect for 10 years. It's you get improved from here to here, and then it lasts about like this to 9 years, 10 years, 8 years, whatever, 1 year. So it lasts about 10 years before you do these surgeries again. Most people look fantastic the first 6 months after a facelift or upper eyelids because they have extra volume in the face, and this blows out the shadows, and it's because all tissue layers are hydrated. So most people wonder why they looked so good the first 6 months, and then things tend to kind of deflate and go a little bit worse after, and it's because the face is healing, the lymphatics are impaired, you can't drain properly, so your face just has more fluid in it. Your immune system's more active, and you don't drain as well. So the tissue layers get more cushioned, and you have less shadows on the face, and people love that. They love the way it looks, they love the way their lips look, their face looks, their eyes, everything. Now, some of the heat treatments are like that too, like Ulthera and those kind of things. They tighten you up and stiffen you for like 6 months, then they go away because your immune system is active during that time healing the injured areas, and then it tends to calm down, and then you lose that effect. So I tell patients, if you want to maintain that effect, there's no great way to do it other than doing PRP microneedling. You could do microneedling with PRP every 3-4 months, and it'll stimulate the skin and hydrate it. The reason you can't fix it or get anyone to 100%, and this was the other question, was, doctor, can't we do anything more about this? Doctor, can't we do anything more about this? And it was a patient who had a pretty impressive result when you look at it before and after, pretty massive, but she still has some shadowing in the face and is wondering, can anything else be done? And I said, I'm not God, I'm just a really good surgeon. I'm like, maybe you should talk to God about that one. But the answer wasn't enough. So I explained, the aging in the face is multifactorial. There are other issues that go on in the face that you can't fix with just a surgery. So let's say I'm doing a facelift. this area over here in the jowls and pre-jowls, if you look at my photos, they get huge changes, but there's always some residual. So I tell people when they say, is it going to be like this? I say, no. It'll be like 80%. You'll get like an 80% improvement. You're always going to have about 20% remaining from all these other factors. And it is because there are so many changes in the face in different layers. Not only do we not know exactly what to do with each layer, but it's impossible to rejuvenate those layers. So when we age, you don't just get fat loss. It is very simplistic to think your face is just fat. You don't just get collagen loss. It's very simplistic to think that your soft tissues are just made of collagen, or your skin is. You get loss in all tissue layers. So your dermis can actually thin a little bit. The hypodermis, which is fat, you can lose a little bit. The SMAS layer, which is largely your hydratatory layer, or the layer of cushion that retains fluid in your face and is responsible for some of the color of your skin and looking radiant. When people wonder, like, why do some people look radiant, some don't, it's because they have more hyaluronic acid probably in their dermis and in their SMAS, or they carry more water in both and they reflect light better, so they look more radiant regardless of pigmentation. So all these tissue layers with elastin, collagen, hyaluronic acid, desmin, vimentin, you name it, every tiny thing in your skin can become depleted over time or change its character, and you carry less water, you have less fat. So all these things tend to atrophy. Now, it's impossible to go back in and replace every single one. That's why we do a shotgun effect treatment sometimes, where we'll go use a radio frequency to damage everything in the dermis and say, please, I hope you can recover and regenerate some elastin, hyaluronic, and collagen. Or we go in and do fat grafting, and we try to do it in multiple layers to plump it up. Or we do hyaluronic in the SMAS with these Profilio or other types of fillers. But nothing can replace every layer that was deflated. And so I tell my patients, I say, don't expect perfection. I can do a great job. I can do better than anybody can, or as good as anybody else can, but you'll still have some deficits. And I can't fix everything because there are too many things and too many layers to fix. It's not possible. So that's really what I try to explain to my patients to expect. Ultimately, it makes no difference. They still want everything to be perfect and still want everything to be better. You can't blame them. We're all perfectionists if we're going into this world of plastic surgery. But not every kind of bit of perfection can be attained. And it's important to know that, because sometimes you chase things and go too far and end up making things worse. So the other thing I try to tell patients today is that there's not always a solution. So I did have some patients wait 6 months to see me, sadly, and when they got here, I told them, no, there's nothing to do. You shouldn't do anything. And to them, that's, fortunately they understood it's good advice and saved them from doing something bad. Some people would come in and think I wasted their time. Ultimately, it's difficult to assess people sometimes just from photos, so you do have to see them in person. So questions regarding duration of lifting for each thing came about. So how long does a brow lift last? A brow lift for most people, if you do an endoscopic style brow lift, should last about 10 years if you maintain it with Botox. If you don't maintain with Botox, it can come down around 5 years or sooner. Or if you don't do a great brow lift, obviously it can come down sooner. Patient asks me, why do I still have wrinkles here? And I explained, you can do the old school style brow lift where you cut out skin and do a forehead type reduction or a coronal lift and pull everything back, and you will have reduced wrinkles, but you might look a little unnatural and age differently over time, because it's impossible to design a brow lift appropriately for somebody where you go and cut out a certain amount of skin, because this part of the brow came up, that part of the brow went down, this part of the brow came down, this part medialized, that part lateralized. So it's impossible to go try to draw something that compensates for all those bits of drooping that have happened over time. Whereas if you go in and do a deep plane or endoscopic brow lift, you just go in through incisions, you release everything, and you just go back to where it naturally came from. So you actually do get a better lift that way, or more appropriate lift. So I tell my patients, I would rather do a endoscopic, less invasive, a little bit more natural brow lift, and then depend on Botox rather than do those cuts. So let's say you do either one of those, it'll last about 10 years if it's done properly. For upper eyelids, same thing, it lasts about 10 years. And upper eyelids, you could do skin reduction, fat grafting, fat repositioning, chemical peel, lasers. You could do all that stuff as far as upper eyelid surgery goes. Lacrimal glandpexy, all this is upper eyelid surgery. Also about 10 years. Lower eyelid surgery really depends because you can do fat repositioning now. I advise people do not do fat reduction unless there's a specific indication, like you have one fat bag left after 2 surgeries. Okay, go reduce it. Otherwise, fat removal surgery, in my opinion, has no place in the year 2022. We do fat repositioning, unless you're doing grafting at the same time, fine. But we're doing fat repositioning, and when you do fat repositioning, that should be permanent if it works. So one part of the lower eyelid surgery can be permanent. However, you do still hollow over time, so you'll likely need a touch-up again sometime within 10 years. Could be a laser, could be a skin excision, could be a canthopexy if you droop, could be a million things. As far as lip lifts go, lip lifts, I don't know how long they last. I think for most people, we could assume that they will not grow out of the lip lift in about 30 years, 20 years. I don't know. I've only been doing them about 8 years. So my guess is about 20, 30 years, although it's not impossible that somebody would need a bigger lift. Facelifts, there's a difference between small SMAS plication, extended SMAS lifts, max lifts, high SMAS lifts, deep plane lifts, and extended deep plane lifts. So all these have a different amount of lifting, and on different skin types and different face types work to different extents. So the bigger lift you get in general, the bigger improvement you get in general, the longer it's going to last. The less scarring you have, you can assume it's going to last longer. So the way these things work, which I've said in other sessions before, is SMAS plication is done by elevating the skin, grabbing the SMAS layer, and tying it up with stitches, tightening it up. That you're not really lifting anything. To lift something, you have to release it from its insertion point, take it up and put it back down without any tension so it heals in that new position. If you go and try to tighten things by pulling, you don't get much of a lift because the skin, the soft tissues just grow around the stitch over time. It's a human body. It's not wooden nails, so it tends to go back down. But you can get some good manipulation of the platysma because everybody who does a SMAS plication goes in here and does a little bit of a deep plane, whether they know it or not. And they grab that muscle, bring it together, and then laterally there's a bunch they can do. So either way, with the SMAS plication lifts, if you look at older series, the more limited SMAS plications usually have a big effect for about 3 years and then they mellow out. The nicer SMAS plications, or more skilled surgeons doing them, can go 5 to 10 years, really just depending on the surgeon. The quoted amount of time in literature is about 8 to 10 years. If you look at the studies from Matarazzo and everybody who we're doing research studies on when people come back for surgery. And it doesn't mean that everything lasted 10 years. It just means that's how long they go before they come back for surgery. A deep plane is kind of the same. You look at about 8 to 10 years, 10 years or so. The difference is the deep plane. If you do a little deep plane, you get a smaller change. If you do an extended deep plane, that means you released everything. So modified extended deep planes means you release everything here, you release the neck, you release everything and bring it up. The more you release, the bigger movement you get, the longer it lasts. Still, you're not getting much over 10 years. So is there a difference if you're revising both of them at 10 years? Yes, there is. If you do a big extended deep plane, you will look better from beginning to end of that 10 years than you would have if you did a lesser lift. Again, this varies from surgeon to surgeon. So someone saying they did a deep plane versus a SMAS really makes no difference. You have to look at the surgeon and what kind of change they're getting. You can have surgeons who do SMAS plications who get incredible results, and you have surgeons who do deep plane who get really shit results. So it really is all surgeon based. So I think that is largely what we went over today with all the patients. And the other question was, I lost fat over time, can I restore it? I tell people no. What we do is we take fat from somewhere else and we try to mimic the fat that was lost. It does not restore the fat that you had. And in fact, it has a different brain. When you bring abdominal fat and put it in the face, it's going to grow like abdominal fat. And they ask, does it survive? And I say, yes, it can survive. But no matter what, you get a benefit. So people always ask, how much of the fat's going to survive? The answer to that is 0 to 100%. You do not know. No one can tell you 30% or 60% or 75%. You have no idea. Fat lasts however much it lasts. All we know is that if you inject it faster, when you take it out of the body, it'll most likely survive better. If you add PRP to it, it'll most likely survive better. But no matter what, when you inject fat, it does have some kind of benefit to the skin. It has some kind of weird stem cell potential and makes people look a little bit better. But it does have a mind of its own, which means if you get fat in your abdomen, your face can get fat. If you have hormonal changes from menopause and your fat cells change, they can change in your face and they can grow. So you never want to inject enough that you can't control. And fat injected can also add volume once it's injected. So if you inject fat and you inject 1 milliliter and it survives, just like Sculptra sitting there, fat can induce an inflammatory response around it, and you can actually grow volume from granulation around fat. That can happen too, especially in the lip. Collagen. Can collagen be restored? No. Don't be stupid. You cannot restore collagen that's been lost over time. You can, however, make more collagen. There's a difference here. And it's important to know the difference because people think that injecting Sculptra, Radius, all this stuff regenerates collagen that was lost over time. This is not true. You're adding collagen in by forming scar tissue, but you're not replacing the collagen that was lost. It's almost impossible to replace the collagen that was lost by doing those things. However, if you do radiofrequency treatments, microneedling with PRP, you do all these different things, you can generate new formation of collagen. You can generate other good types of connective tissue within the dermis and underneath. However, it's never exactly what was there before. So it's really important to know that in aging face surgery, we are doing everything we can to mimic what was lost, but we cannot restore to how things exactly were. Last question was about symmetry again. Doctor, I went to my other doctor and they said that during the surgery you could have made the brows more symmetric. And I said, well, it's not possible because we are asymmetric. And she said, well, I understand, but surgery, you can make it more symmetric, can't you? I said, yes, to some extent you can. So the reason we have asymmetries in the face is not only because we grow differently on each side of the face, depending on how we age or droop, but it's also because we have different neuromuscular dominance patterns, which means that the brain can tell this part of the face to move differently than that part of the face because they're wired differently and together. And this part can actually move differently than that part and that part. So you can be dominant on this side of the face, but this side of the brow. Dominance on one side of the face or one side of the body is what leads to one side being stronger than the other, just like if you're right-handed or left-handed. So when somebody is dominant on one side and their brow is higher on one side, you can do all the lifting you want in the world. That side will always want to go higher. The only thing you can do to change that is Botox, because you're affecting the neuromuscular cascade, let's say. And the other thing is, if asymmetry is bad enough, then yes, physically you can actually do an asymmetric lift directly to bring one side higher than the other, but it has to be different enough. So you can't just have like a little shape change and a minor shape change and say, I'm going to make them symmetric. It's not going to work. But if it's bad enough, then yes, you can get improvements in symmetry. So symmetry also is really irrelevant for most of what we do in beauty. It treats neurosis, meaning it treats patients' anxiety and patients nitpicking about things. It does not change how people perceive them nor their beauty in about 90% of cases and what people look for. However, there are 10% of cases that it is important to treat asymmetry because the asymmetries are affecting how someone looks, because it's either affecting their function or it's straining their face, or it's to the point where you go to Babak Azizadeh, who's the master of treating real facial asymmetries from facial paralysis. So those are cases where you really want to treat it. Other cases where you want to treat asymmetry is where the nose is one side higher than the other. Midline structures tend to be more perceptible. You can see them a little bit better and notice them, and it bothers people's eyes a little bit more when midline structures are asymmetric. So those are some exceptions. But overall, when people come to me looking for symmetry, I advise them I'm not that kind of doctor. I like to make things look really, really pretty, and I do everything I can to make it look pretty. I don't do things for no point. It's not fun, I don't enjoy it, and it's not going to improve beauty. So 90% of people who ask for the symmetry, I don't really do much for it. I don't think it'll help them. But 10% of people I certainly do, because they see some things I don't sometimes. They'll see like a cheek is higher on this side, flatter on that side, and they say, you know what, you're right. We should actually improve that symmetry, you look better on both sides. So these were the questions for today, which are general questions that you receive a lot in this world of facial plastics and plastics alike. I will post this in case anybody needs, and in case I'm a little incoherent, it's because I've been going straight from 6 in the morning without a break. So 7 o'clock and we gotta go. Hope everyone has a lovely night. I'm headed to my friend's birthday dinner.